So now that we have a formulation and we have Emery's buy-in for the formulation, we're ready to move on. And you'll notice that I'm talking a lot about stuck spots when I'm talking about ACT. And it's really one of the things I love about this modality is that therapists are humans, and so are our patients, and so is everybody else. And we all have our stuck spots. We all have our thoughts and feelings that we don't like. We all have our dots that we use to avoid them or distract from them. And we all have our long-term consequences that don't work out so well. So really, we're talking about stuck spots. And I like to normalize that with my patients. And that's, I think, where this connects to the idea I brought up earlier that I'm not so fussed about diagnosis unless I need to be for some reason. For medication referrals perhaps, or for accommodations at school. But other than that, ACT is transdiagnostic. And what that means is we're looking for that ABC pattern. We're looking for that stuck spot. And so, our experiential avoidance, whether it's not eating too much, lying in bed and not getting up in the morning, feelings of sadness, the anxiety that Emery is experiencing, can all be put in that ABC pattern. It can all be put on a hexaflex. And so now that we have the formulation with Emery, we're going to move into the treatment. And it's just a good spot to mention as well that dots are not all inherently bad. And I would at some point be emphasizing this with Emery, that, again, we all have our strategies to avoid. And I would probably share that mine is games on my phone. It was shopping, but not really much anymore. But for the purpose of distracting myself from stress. Long-term consequences, I get home with my bills and sometimes with stuff I didn't really like, and then I'd have to spend more time returning it. So just to really normalize for people that we all have our stuck spots. So again, dots are not all bad. Sometimes we might need to distract for a few moments just to get our heads on straight and catch our breath so we can decide what to do. And sometimes we might use our dots as a free choice because we've decided we can live with consequences. So not all bad, as I said, and we want to normalize. And we're going to do that as we go through treatment. And so, again, we've got our formulation. Now I'm going to say to Emery, so do you think you've used your dots enough and enough of them that you've really given it a good try to get rid of these thoughts and feelings? And Emery may either just say, yep, or look kind of puzzled at me because they've never been asked that question before. But it comes from that place of normalizing, like, have you given this a really good shot? And they have. So then I can offer this to Emery. How about we do something different? You're putting a lot of time and energy into trying to get rid of stuff, and it's not going anywhere. In fact, it's getting bigger, and your life is just getting more and more difficult. So what if we stop? What if you get to just loosen your grip on those dots and you don't have to try to avoid anymore? And when I started using ACT, I was a bit nervous to say that sort of thing to people, figuring nobody was going to agree to that. And turns out most people do. Now, if Emery doesn't quite agree with this idea of learning to just have thoughts and feelings and take them with them instead of trying to get rid of them, I would engage Emery in a little exercise, and I'm going to do that with you now. Could you just take a second and imagine some type of a scene from earlier today? Maybe it was just before you turned on this video. Maybe it was having breakfast, getting up in the morning, anything. Just have an image of something in your mind like a snapshot. When you've got it, I'd like you to get rid of it. I'd like you to delete your thought. Any luck? Now, when I do this with teens in groups, it's particularly fun because usually at least one of them will say, I got rid of it. Great. What was it? And then they realize it's a trick question because if they can tell me what it was, they didn't really get rid of it. And then they're in the same boat as everybody else saying like, I can't get rid of my thoughts. I can't delete them. And it's just another way, kind of a fun way to help them see that, you know what? Dots are normal. I use them. You use them. And they don't work. We can't control our thoughts. And that's, I think, a very unique perspective in ACT, that the role of the therapy and one of the goals is not to change our thoughts. So it's what we call illusion of control, if you wanted to look up those exercises. We can also ask people how they're doing. I'm going to say to Emery, like, can you control your feelings? Can you just turn them on and off like a light bulb? And if I had a light switch near me, we'd be flicking the switch because I like anything that's behavioral and hands-on. I find teens remember it much more than me just yakking at them. So the experiential stuff is great, but can you just like genuinely switch your emotions on and off? And most of them can't, which, by the way, I'll sneak in the idea this is helpful with parents too. If you're working with parents who are saying things like, stop worrying, or you have nothing to be depressed about, don't be so angry. We humans aren't so good at just turning our feelings on and off like a light bulb. So with ACT, we don't have to. It's actually rather freeing.